everyone. My name is MIchele Holmes, LMT. The LMT stands for Licensed Massage Therapist. This means that I am licensed by the state of Florida as a healthcare professional. I originally completed a 710-hour program of training, and every 2 years since then I'm required to take an additional 24 hours of training. I've actually completed a lot more than that. In the 8 years that I've been in business, and I've received extensive training from some of the most well-known and respected names in my industry, such as Dr. Judith Delaney. You have one of her articles there. You can read that at your leisure. I worked with Kenneth Percio. I worked with the Appalachian Institute. Let's see here, where am I? I've been trained in Neuromuscular Therapy, Cranialsacral Therapy, Cranial Structural Release, Active Assisted Isolated Stretching with Aaron Mattis, and Ashiatsu Barefoot Massage, and many others. So one of the things that B&I recommends is that we don't take questions during our 10-minute. If you have any questions, please see me afterwards or schedule a one-to-one with me, or even better, schedule a massage with me like Jim said. I'm going to tell you a little bit about what neuromuscular therapy is. It is the application of pressure and direction of that force to areas described as trigger points. Don, could you pass one of the videos out?
Sure.
So that everybody can take a look? Thank you. Trigger points are places where the muscle fibers have become so overly sensitive that they are manufacturing pain signals that are either directly in that area or are referring to another area of the body. That means you can have pain in the palm of your hand that's actually coming from the bicep or from the neck. Another type of treatment that usually goes hand in hand with neuromuscular work is myofascial release. This is work that releases tangled muscle fibers and scar tissue, allowing the muscle to work more effectively and efficiently. Think about the person who comes home too tired to enjoy their evening hours. When muscles work inefficiently, they're drawing more energy from the body to work. There's only a finite amount of energy in your body every day. When we use too many muscles to accomplish our tasks because we are compensating for pain problems, we can easily, over time, become to where we're getting to where we're exhausting those energy reserves. I've always described my job as something between a sculptor and a mechanic. I assist clients in rooting out the causes of inappropriate movements and help them break down scar tissue surrounding injury or repetitive motion movements. I help them to feel like kids again. I provide stellar neuromuscular therapy to my clients. I am very good at finding those trigger points and figuring out what's causing that problem, and I'm also good at judging how deep my pressure should be without causing the client pain. A lot of massage therapists go too deeply too quickly. That can lead to bruising. It's definitely painful, and it actually can help teach your muscles not to like massage. Clients who come to me can expect to have their pain issues dealt with fast. My clients often tell me they feel younger and more active than ever before after a few sessions with me. One of my clients was in her 80s, and she told me that before she met me, she felt like she was waiting around to die. She was in pain. She could not move her neck at all. She had been kind of written off by her chiropractor, not our Miss Charities. And her thinking was slow and confused. Just a couple of months after we began working, we got 50% of her range of motion back, and we greatly reduced her pain levels. And suddenly, she started telling me about the books she was reading, about learning to play mahjong, which is difficult if anyone's ever tried that, about trips to the museum with her seniors group, and even about poker night with the girls. Massage improved her quality of life by reducing her pain, increasing the circulation and blood flow to her brain, and allowing her to feel safe driving again because she could move her neck. And in case you were wondering, through our work together, we eventually got her completely pain-free. She moved back up north a few years ago so she could spend time taking care of her great-granddaughter. All this from a woman who had been waiting around to die. Doctors tell us that we now have every expectation to live well into our hundreds. So if that is the case, we really need to decide how we want to feel during the next 25 years. We need to take steps to start to care for our body maintenance, and that might include massage, chiropractic care, acupuncture, yoga, and meditation. The other thing that I wanted to talk to you today about is couples massage. You've seen my couples massage DVD come around. I offer 2 great couples massage packages. One is the traditional tandem massage, where you and your sweetie are in the same room side by side, while myself and another skillful therapist whisk away all your stress and tension. The second is a private 2-hour session with me where I teach you both how to work on each other's problem areas. People often complain that massage is hard for them to do, so I can teach them ways to use their body weight and make that easier to do. These packages are the highlight of the romance packages at the Hyatt Regency and other hotels and venues in the area. I also offer great couples massage DVD, which makes for a great birthday present, Father's Day, wedding, or anniversary gifts. The DVD came about as a result of me having these massage packages and people saying, "Hey, do you have a class?" And I was like, "Oh, okay." So then I started teaching classes, and then they were like, "Well, hey, do you have a DVD?" So now I do. We'll see what else they ask. Yeah, so some of these moves in the DVD are so easy and effortless that, you know, if your sweetie wants you to do them all night long, you can. The best referral partners for my business is for you all to invite a personal injury attorney, dentists, naturopathic doctors, florists, wedding and event planners, electricians, or any other professional that work hard and can use relief from stress, tension, and pain. So for referring clients for neuromuscular therapy, when you meet people who say they can't sleep, can't play their favorite sport, they can't pick up their grandchild, they can't drive, they can't stand comfortably, they can't sit comfortably, they can't be on the computer for too long, they can't eat without their jaw clicking, or they can't enjoy life the way they want. Let them know that they don't have to live that way, that there are answers, and even if massage can't address every problem they have, seeing me is a great way to start to find alternative medicine therapies that can help them stay well and get well for a lifetime. For couples massage, people who are celebrating something special, people who need to celebrate something special, people who are visiting the area, people who are in love, people who are need to fall back in love, people who need to spend quality time together, who enjoy each other's company, and who want to feel great, be happy, and have champagne. So, remember, if you want your family, coworkers, customers, friends, or enemies to feel swell, see Michele.
Oh, good job.